Picture this. Diseases we believed were banished forever are staging a shocking resurgence in America, putting millions at risk. Fresh vaccination maps expose the alarming truth about outbreak vulnerabilities. Is your county truly shielded? But here's where it gets controversial. These maps reveal a troubling trend that's sparking heated debates nationwide. Across the United States, vaccination coverage is steadily declining, coinciding with a dramatic spike in measles infections, as detailed in newly compiled county-by-county data from state health departments. Measles, a highly contagious illness, has infected more individuals this year than in any since the early 1990s, tragically claiming 3 lives already. By 2025, every state except 8 has documented cases of this disease, which the U.S. officially eradicated back in 2000. Astonishingly, about 92% of these infections occurred in unvaccinated people, or those whose vaccination status remains unclear. Federal statistics unveiled in July indicate that childhood vaccination rates, once stable for years, have dipped, while exemptions granted for religious or personal beliefs have risen. This erosion of trust is directly linked to the outbreaks, as explained by Adam Ratner, a pediatric infectious diseases expert on the American Academy of Pediatrics Committee on Infectious Diseases. As confidence in vaccines wanes and rates plummet, measles outbreaks are the first red flag we see, Ratner warns. He emphasizes that these flare-ups serve as a critical alert system, hinting that other preventable diseases might soon follow suit. And this is the part most people miss. The ripple effect could extend far beyond measles, Ratner adds, pointing out that less contagious but still vaccine-preventable illnesses are likely to emerge next. To pinpoint local vulnerabilities, Johns Hopkins University gathered information from state health agencies, filling a gap since no national database exists. USA Today built on this by incorporating missing states and bridging data voids. Their combined analysis, encompassing counties in 41 states, reveals that routine childhood vaccination rates have fallen in the majority of areas, heightening outbreak risks compared to pre-pandemic levels. In fact, at least 3/4 of counties now fall short of the 95% coverage mark that experts deem essential for preventing widespread epidemics. With so many counties below this benchmark, exposure risks are significantly elevated, notes Lauren Gardner, head of Johns Hopkins University's Center for Systems Science and Engineering. She clarifies that while this doesn't guarantee an outbreak, introducing even one case into a low-coverage community amplifies the danger. Experts further caution that dropping below 90% sharply escalates outbreak potential. For instance, immunocompromised kids or those too young for shots depend on herd immunity, a protective barrier created when enough people are vaccinated to stop disease spread in the community. Currently, only about 63% of counties hit the 90% minimum, down from 84% before the pandemic. This data, paired with insights from public health professionals, highlights how doubts about the COVID-19 vaccine have bled into broader immunization attitudes, fueled by rampant misinformation and falsehoods. Vaccine skeptics often spread the debunked myth that the measles vaccine triggers autism, a claim thoroughly refuted by mountains of scientific evidence. Yet, this growing skepticism is deterring parents from protecting their children against serious threats. A September survey by KFF and the Washington Post found that 9% of parents buy into the false autism link, and nearly half are confused about what to trust. The MMR vaccine, which guards against measles, mumps, and rubella, is a key player here. Roughly 1 in 6 parents admitted to postponing or skipping vaccines, not counting flu or COVID shots, citing worries about safety or mistrust. Parents who lean Republican, are younger, or homeschool their kids are particularly prone to these delays, according to the survey. The Centers for Disease Control and Prevention advises 2 MMR doses for children, the initial one at 12 to 15 months, followed by a booster at 4 to 6 years. They also endorse shots for polio, chickenpox, and hepatitis B, a liver-targeting virus. But these guidelines are under fire from Health Secretary Robert F. Kennedy, Jr., a vocal vaccine critic. In June, Kennedy dismissed all 17 members of the CDC's Advisory Committee on Immunization Practices, ACIP, swapping in some skeptics. The ACIP has already tweaked the MMR schedule, dropping the under 4 recommendation, and pondered changes to hepatitis B guidelines, though voting was postponed. Critics argue these moves could sow more confusion and further slash vaccination rates, especially when vaccine safety and availability are already murky. Ratner stresses the value of the detailed data from Johns Hopkins and USA Today in spotting at-risk groups. State-level stats matter, but local ones, like county or even neighborhood rates, are what really count, he says. This dataset focuses on kindergarten vaccination compliance, sometimes extending to K-6 or K-12, tracking MMR or full school-required doses. However, there are limitations. Data collection differs by state, so comparisons need caution. Some states measure compliance with rules rather than actual vaccinations, potentially inflating true rates. For example, Oregon omits exempted students from their figures, while Wisconsin includes them. As a result, school compliance might exceed the actual vaccination rate in the student body, explains Jennifer Miller from Wisconsin's Department of Health Services. Measles used to afflict millions annually in the U.S., causing hundreds of deaths. The 1960s marked the start of widespread vaccination efforts, leading to its elimination by 2000. By 1980, all states mandated school vaccinations for enrollment. Measles is especially perilous because it spreads before symptoms show, and though fatalities are rare, it can lead to severe issues like brain damage, nerve problems, and vision loss. As of September 30th, the U.S. has logged nearly 1,550 cases, eclipsing any outbreak since the 1990s. Only 2019's New York spread among unvaccinated groups comes close. The 2025 outbreaks began in Texas's Gaines County Mennonite community, where low vaccination rates fueled the fire. It then swept through West Texas, New Mexico, and Oklahoma. Gaines County alone reported 414 cases, about a quarter of the national tally, with kindergarten coverage averaging 82.4%, well below the herd immunity threshold. Pre-pandemic, 57% of counties were fully outbreak-proof. Now, it's just 25%. Coverage dropped in nearly 3/4 of counties, averaging a 4-point decline. Only Connecticut and Maryland have all counties above the bar, while 9 in 10 in Maine and New York qualify. No counties in Alaska, Hawaii, Idaho, Utah, or Wisconsin meet it, states with high exemption rates. In July, the CDC estimated 286,000 kindergarteners lacked MMR completion proof for the 2024-25 school year. Meanwhile, non-medical exemptions, religious or philosophical, climbed to 3.4% from 2% a decade ago, though medical ones stayed steady. Even minor hikes matter, says Elizabeth Williams of KFF's program on Medicaid and the uninsured. Each uptick hinders reaching the community protection level scientists advocate. Experts urge keeping exemptions under 5%, but 17 states exceed this. Idaho tops at 15%, with Utah and Oregon at 10%, and Arizona and Alaska at 9%. Rising exemptions worry us, assuming exempted kids are unvaccinated. Notes A.J. McWhorter from Idaho's Department of Health and Welfare. In outbreaks, more children face infection risk and possible school exclusion. Policy tweaks could worsen this. States like Florida are easing waiver processes or scrapping mandates entirely. Since 2021, over 2,500 vaccine bills have been proposed nationally, half focusing on mandates or exemptions, per the National Conference of State Legislatures. These shifts, plus federal changes, ongoing misinformation, and access hurdles, will exacerbate issues, warn Oregon Health Authority epidemiologists. Ultimately, public health demands collective effort, as Gardner puts it. Everyone must participate, or it simply won't succeed. What are your thoughts on this? Do you believe vaccine mandates should be tougher to combat these risks? Or is personal choice paramount? Is the rise in skepticism justified or driven by misinformation? Share your opinions in the comments. Let's discuss.